want to continue with our program and hear more perspectives on these interconnections between poverty and food security and health. And next we have an exceptional professional who we're excited to have joined our High Point community. Curtis Holloman is the executive director of the Foundation for a Healthy High Point. Mr. Holloman is a North Carolina native. He's worked up and down the East Coast with organizations committed to positive health outcomes for all individuals and communities. And we're so thankful to have him here in High Point with his expertise and knowledge. And so Curtis, I will turn it over to you.
I'll start sharing my screen here. Okay, can you all see the slides?
Yeah, we got it.
Okay, good. Thank you, Joe. I appreciate that. Let me turn my timer on here. I do tend to talk a lot, and I am inspired and just really moved this morning from all of the conversation and all of the discussion that we've had, particularly Hector and those kids telling and sharing with us what they need and in terms of poverty. And we all bring our own story, right? I certainly have my story that I've been thinking about and reflecting upon my growing up in poverty in northeastern North Carolina. And part of what I've been thinking about is like, what happened, right? What happened to me? And what has happened to a lot of us that we are no longer living in poverty. So, and I want to come back to that question at the end of my my little talk here. But anyway, I am delighted to be in this community. I'm delighted to be part of this. I'm also reminded of, I think it was just 2 or 3 weeks that I was in this job, and Carl gave me the tour of High Point and really pointed out to me, you know, the conditions and the situations and some parts that a lot of people don't see and don't get to. So anyway, what I want to do briefly, I want to talk a little bit about the foundation and our strategy, because I think it's very relevant and it relates to some of the themes that I'm hearing and that we're sounding here. And then I'll dive into a few numbers. We've had a lot of stats. Gene did a great job of putting the data out there in terms of poverty. And he also brought the subjective, the emotional aspect of making a case for why we need to focus on poverty. I think we know clearly that it's not about the data. If it was just about the data, we could galvanize support, we could motivate individuals, and we could really impact. But it is about how we can tell our stories and how we can move people. So I've been really impressed with that today. So just quickly, I just want to share, the foundation, who we are. Most of you, a lot of you we're partnering with, but we're a private foundation here in High Point, came about in 2013. And I like to share this and point it out because I want not just the nonprofit community, but the business and the public community and government to just know, as a strategic grant maker, we really want to be a partner with folks. And as I get through some of these slides today, you'll see how we propose to work and address some of these big issues that impacts health. Our service area, of course, Greater High Point. I also like to let people know that Jamestown, Archdale, and Trinity is part of that work as well. We are currently working with about 45, we call them funded partners, in a variety of areas. In the past, we've focused, and currently now, we've done a lot of focus on maternal and child health. We're talking about child health poverty today and how that's important and what's happening there. We've done work in partnering in terms of behavioral health, and certainly capacity building for a number of our nonprofits that are focusing on issues related to poverty and emergency relief. I just want to kind of showcase here or just pop up the 4 funded partners or organizations that we are currently working with as a part of addressing the food system and making sure that we have in place a sustainable system that address some of the immediate needs that people have related to food and poverty and health as well. And we've heard from some of the speakers this morning, Rachel and others, a really good program and programs that work in our community. This slide here, I like to share this here. This is the old upstream, downstream approach to this work. And as a part of the foundation's strategy and moving forward, we're really, we're hearing from folks in community as we've been engaged in a strategic planning process. And we're bringing our best thinking about like, how can we work in community and work with everyone to address these social determinants, you know, poverty being one of those. And one of the things that we want to see is how we can work upstream, you know, poverty being one of those upstream issues. And I like this to show the strategy. You can see the tactics here that we feel like we can work with in community. Because someone who grew up in poverty, myself, I know that it takes a system to respond and move me out of that. You know, it wasn't me, my family pulling ourselves up by our bootstrings and hard work that did it. No, it was opportunity. It was opportunities in education. It was opportunity in terms of loans and financing loan and, you know, getting a farmer's home loan for, you know, it's really good government that works. It was also, you know, communities that responded. So this is one of the aspects of, I think, what we should look at as a community. And we're certainly interested in how we can work upstream on some of these issues as well. One, I mentioned the strategic planning that we've been doing. We're learning a lot from there. As you can see, whoops, let me just go back here. You can see the different areas that are emerging as issues. You can see the ones that we're talking about today: food security, housing, good paying jobs, homelessness, economic vitality as well. So here's my commercial plug here. In your chat box, you're going to see a link, because we want to hear from you still. We want your input into this work and this plan. So magically, I think if not already, you're going to see a link, and please click on this link to our survey. We've been engaging people in focus groups, et cetera, but we're also doing, you know, continue to engage that process. So I wanted to share that strategy because I think that we're embarking upon. So it's the how, and it's also the focus area, because I think it is relevant to our discussion today. Okay, now, poverty and health. I like this social determinant of health kind of strategy. It looks at length of life and quality of life. And this speaks to the point of where we can go to have the biggest impact as we stay engaged as a community, as we come together. 40% of social and economic factors, and these are the things we've been talking about today: education, employment, income, family and support, and community safety. That's what's going to impact our health. And I think this is the answer. Like, you know, there's just no secret, there's no magic. This is kind of the obvious, right? That people with higher incomes, people out of poverty in those conditions, are healthier. And this chart really speaks to how we can approach that. I also like to point out, we think of the clinical and the medical care when we think about health, right? Only 20% of what happens in a medical office, hospital, or facility will contribute to overall life expectancy and health as well. And that's kind of revealing, and that tells us where we really need to go and focus from a health standpoint of addressing health. Let me move through some of these slides here. So I won't get into the population changes. I think a lot of this has been talked about, the racial and ethnic diversity that's happening in our community and how that's going to impact us, and how some of these issues around poverty and food insecurity, they're going to be with us, and the trajectory is to get worse, right? And I think that's another calling for us to look at upstream and look at approaches that's going to address policy and structural changes as well. So anyway, income and livable wage. I mean, you know, the per capita in High Point is about $12.34, well below the livable wage of $15, not well below, but slightly below, and certainly doing worse than our state is. Social vulnerability and certain indicators about a burden in terms of housing and how that comes into play in terms of what's changing with the population. A lot has already been said about that. Socioeconomic and health characteristics. This is where just kind of a reminder of some of the data here in terms of the number of the residents in poverty compared to North Carolina. What happens with poverty, crime, and infant mortality is certainly an issue that we've been focused upon. A number of partners have been focused upon infant mortality, and particularly within the minority community as well. Now, here is the life expectancy. And this is what I hear and a lot of us talk about, the difference in place. 15-year difference in life expectancy between the lowest and highest census tracts. And let me show you a map that's going to visualize this particular data. And what we're talking about in South High Point and Northeast High Point, you can look at the difference in terms of the life expectancy. And when you look at that particular data and you look at the poverty, right? And you look at all these other issues we're talking about, you're going to see that they're overlapping. This red represents the life expectancy here, okay? Then if we look at economic security, a measurement of poverty, look at the dark, I think that's blue or purple. Look at that and you'll see that it overlays with the same areas of life expectancy, okay? And life expectancy, we know, is related to chronic disease, and chronic disease is disproportionately impacting low income and people who are living in poverty. So I think that's the big, okay. And I think even when you look at our county, you really have to zoom in and focus on neighborhoods and in particular communities to really see how poverty is impacting health and these other conditions as well. Okay, so then transportation is another one of those upstream conditions. You can see the dark orange colors. It's in the same communities as where we have a shorter life expectancy. It's in the same communities where we have no jobs, low income. It's in the same community where you see the housing burden, where people are paying more than 30% of their income in rental housing. I want to move through this here. So here's the housing, rental, and occupied. You see the purple areas are where people are renting. And I like to share this one because when you think about lifting people and getting out of poverty, it is about wealth transfer. And people who are burdened and paying more than 30% of their rent for the rest of their life, they don't have that opportunity for the next generation to transition and move out of poverty. So that's why I like this particular data in this slide covers. Insurance and Medicaid access. We know people who are poor have to make tough decisions about healthcare coverage and costs. And we have a system where we don't have everybody covered in Medicaid that don't have private insurance. We also have a medical system that's reliant upon coverage that you have a job and that you're working. It makes no sense to me. You've got to have, a response for the public good to make sure people have health coverage. Why can't we have 100% health coverage? So anyway, we can see in those same neighborhoods where there's poverty, we see a disproportionately representation of lack of health access measured by insurance and Medicaid access. Social context, we talked about the racial makeup and the difference and the challenges, the new immigrant population. High Point's been a refugee hub as well. And we can see in these same areas where you have poverty, where you have the transportation issues, you have the housing issues, you have a disproportionate number of people who are people of color, African-American and Latino. So I, just to that was kind of a quick through of some of the health data and some of the issues here. what I want to just kind of wrap up, if I can take another few minutes, is just sort of food for thought. And how do we change? And I know there's going to be some other discussions with this, but these are the issues that I ponder with, because this is a huge, and it feels like overwhelming. And I think it's important that we have, Carl, and we're having this summit here, really focusing in on poverty and where we're going from here. But basically, how do we do the collaboration that's needed? How do we cross sectors? How do we include folks who are impacted and have those stories? And how do we sustain that effort, that process, that we don't give up, that can lead us to policy and structural changes that we really know is going to make a difference, right? That we can build a system to help get my siblings and myself, get us out of poverty, that we build and ensure that everyone has opportunities, right, to get out. That's the challenge for us. Is how do we, let me go back here, how do we stay at it as a community and really take on these big issues and these challenges? Today is an example, and we've got a lot of efforts going on in terms of resources and in our community. We've got to maintain that baseline and that level of support and in services and helping folks, at the same time that we're staying up high and that we're working upstream. How do we leverage resources in addition to what we have locally? How do we bring evidence-based and best practices? How do we go back and look at what's working and scale it up for the entire community? The other thing that I heard earlier today, and I was glad to hear that, is about advocacy again and policy. We got to stay at it. And how do we translate that into effective changes? In the meantime, we've got to sustain and coordinate current service levels to keep people above water as well. So thank you very much. I appreciate it. My apologies for running over a bit, but I appreciate the opportunity to share some thoughts with you and also engage. And then, just know that we have a community resource. We have plenty of resources, but also that you have a partner in us who really want to engage, not just bring in resources, which we can, but also just engage in terms of convening, in terms of, how do we leverage external resources as well. But just a commitment to be part of this and sustain the conversation and the efforts and the processes it's going to take to get a large number of the population out of poverty. Okay.